Hello, my name is Chris Whiteknight, Senior Medical Esthetician here at Allure Medical Spa. In this video, I'm going to demonstrate with my patient how to do Pico tattoo removal. The area that we're doing her tattoo on is her neck. The colors that she has are blue, shaded, and black. So it's just using the basic 755 on the setting piece. So the first thing that you want to do is I always make sure my patient's area is nice and clean, shaved, so that there's no hair in the area. I have the towel here to help pull her shirt away from the neck area. And I have an alcohol swab, so I'm just going to clean the area to make sure there's no bacteria because we're going to be doing injections in the area to numb her up. Now you can offer numbing cream before the injections. That's a personal preference on the patient. I like to use this little machine. It's an ice machine and it's cold. So I like to use this prior to doing any injections on the area. So I always have gauze handy with my needle. You let me know when it's nice and cold. Okay. Now in the neck area, I tend to just pull a little bit away as I poke in. Always go with your needle on an angle. Don't go directly puncturing into the skin. It's not very comfortable if you do. So because of the area that we're treating, this is just a Lido mix. There's no epi in it. You want to make sure on any areas like neck, ears, fingers, toes, those areas are just using a lidocaine mix. If you put epi in those areas, they will cut off circulation. So as I'm going, I'm just kind of doing some icing and then a few shots sporadically as I go. That way she's comfortable throughout. Now, even though you numb your patient, they might still feel some of it. Everybody's different. I always say the edges are a possibility to be felt. So I always try to make sure that the edges are nicely covered with numbing. And you just kind of do injections sporadically throughout, just so that it'll start to numb the area up really nice. Doing okay? Mm-hmm. Always check with your patient, make sure they're doing okay. Even if they're the most tolerable, sometimes it might not be tolerating. Now this treatment is performed every 6 to 8 weeks. You want your patients to be aware of the commitment that they're in when they're getting the treatment. Also that there's always a possibility of a blister, that they want to keep it nicely wrapped right after getting treatments with an antibacterial ointment or some kind of healing ointment. We do have a really nice Silverdene ointment here that works really good for healing. Some of my patients just use over-the-counter stuff. Now the 755 that I'm using targets blues, greens, blacks, shaded, gray, and then we have a 755 which targets the reds, the yellows, and the little bit more dramatic colors. Doing okay?
Yep, mostly just cold.
Good. Cold is good. So just kind of move this around as you go if you're using this. Like I said, it's a personal preference. If you're using it for the cold, for the shots, I love it. All of my patients love it. Just takes away from that poke. People might have tattoos, but doesn't mean they like needles necessarily. It's funny. You'd be surprised what they tell you. And how old is your tattoo again?
About 5 years.
So her tattoo's 5 years old. Most patients, when they have a tattoo under 10 years old, definitely need more than 5. Just depends on if it was professional or amateur. It also depends on how their ink metabolizes in their body. If they've ever been treated with gold therapy, you cannot treat them with a Pico. If you treat them with the Pico after they've had gold therapy, what can happen is they can look like a Smurf because it turns their skin blue permanently. So you want to make sure you ask that. It's on the questionnaire and know that in their medical history. Most people are pretty up forth and right about telling you they've had it, but you should always ask. It's usually common more in older people because of the generation that they used to do it. Still doing okay? Mm-hmm. Good. Periodically, I like to wipe this off so it's not wet because it starts to drip on the patient. Now she's almost done with numbing. Just a few more spots before we start treatment. Now typically with Pico, you want to keep it wrapped up if you blister really bad, more than a day. I typically air mine out the same night. So everybody's different. I'm allergic to adhesive. So that's a good question to ask your patients to know if they're allergic to tape, because tape will cause them to have a reaction on the skin that's not really good to do while they're having treatment. Still doing okay?
Mm-hmm.
Are you feeling these last few pokes?
Just like little bug bite, maybe.
Okay.
Yeah, it's nothing crazy.
Are you feeling all of them?
No.
Okay. What about here?
I feel nothing.
Good. So what I do is once the laser's loaded, I'll do a spot test and just ask the patient if everything was okay, if they were comfortable, and then I'll continue. You don't want to start it if they felt it. So one little pulse. Did you feel that?
Nothing.
How about that?
Nothing.
Okay. All right, so she's nice and numb. I'm going to just start the treatment. You want to make sure that you are going where their ink is. I don't just outline the area of their skin. I do exactly where their ink is. So as it's treating, you can see it's frosting. That's where the ink is present in the skin. It's kind of a nice guide. Now, as you're doing this, sometimes if there's a little hair, just know that it will just singe it. And you want to do about a 10% overlap. You don't want to go too fast, just nice and steady. Doing okay?
Yeah.
Almost done in that area. Give you a little break and move on. Just have little hairs there. Little fuzzies. Now, if you're feeling it a lot, you let me know. I can do more shots. Sometimes as you're doing treatment, you can see some of the ink disappearing right away. It's really fun to watch. Little spot. So a little spot she felt, so just put a little more numbing there. And I go to another area and then go back to it. So she's almost 3/4 of the way done. You got some crazy ink in here, girl.
2 sessions.
Well, it's just metallic-y or something. That's why all the loud snaps. So the louder the snap, the more the ink is in that area. Almost done. Just a little bit to go, okay? Turn to your left a little more. This way. There you go.
You have to say that.
Right here?
Yeah.
Okay. Just try not to flinch away. It's okay. The whole area? Is it better? Almost done. As you can see, it's not comfortable if they feel it. So if you want to see what it looks like, I'll take those. Go ahead and lay back.
Quick.
Yeah. So if you want to see what it looks like, you can see it's got some area where it's frosted still, where I just finished, and it gets really red. She's already getting a little puffy and you can feel heat in the area. So you just want to make sure that you wrap it up. You want to put some nice ointment on there. Make sure your patient has a clear understanding of aftercare. I always like to give them my email address. That way if it's after hours and they need to get a hold of somebody, they can email me. Plus they can always send you photos. So if you need the doctor, you can always forward it on. Now I make sure there's a good coating. And then you want to make sure you use the side that's shiny because it's a non-adhesive side. You don't want the cotton to stick to their skin because it'll peel off. It's not fun. So I like to just piece this on their skin. Once it's covered, you'll tape it down, and then you'll just make sure they have their understanding of aftercare sheets, and then you'll schedule them for their next treatment in 6 to 8 weeks. This is how you do Pico. Thank you for watching. If you have any questions, please let us know.